A radiology report recommends a follow-up scan in 6 months. The discharge summary that follows doesn't mention it. Nobody made a mistake. The recommendation just didn't survive the handoff between systems, between visits, between the people responsible for it. Months later, nobody is tracking whether that scan ever happened. This is one of the most common, least visible failure points in care coordination, and it happens quietly, with no error message and no alert, until a patient shows up with a problem that could have been caught. CareThread is a care continuity agent built to close exactly that gap. Underneath, it isn't one monolithic AI. Follow Jane Doe's case, and you can see all of them at work. A CT chest comes back with an incidental pulmonary nodule and a recommendation. The moment that document is ingested, the action agent reads it, recognizes an unresolved follow-up obligation, and opens a thread. Incidental pulmonary nodule follow-up, right upper lobe. So that recommendation now exists as a persistent, trackable case, instead of a line buried in a PDF. Time passes. This is where most systems go quiet, but CareThread doesn't. The follow-up agent continuously scans every open thread against its due date, and when one drifts past its window without resolution, it proposes an escalation, surfacing it back onto a clinician's dashboard before it's forgotten a second time. Then, a pulmonology consult note comes in, followed later by a real follow-up CT. The matching agent takes over here. It searches this patient's own history, semantically and structurally, finds that both documents describe the same finding in the same location, and proposes linking them as evidence against Jane's open thread, attaching a confidence score and a plain English reason a clinician can actually read and trust. All of this is only possible because CareThread also gives each patient a real memory. Every report, note, image, lab result, and message they've ever generated, unified into one longitudinal timeline, strictly scoped to that one patient. A clinician doesn't have to dig through it by hand. They can just ask, what follow-up is still outstanding for this patient? And get an answer grounded only in that patient's own documented history, cited back to its source. There's a fourth agent, and it does something none of the others do. It's allowed to look across patients, but only within one consented family. The family agent watches for shared patterns among blood relatives, and when Jane Doe and her sister Susan turn out to share the same finding in the same anatomical location, it flags that as a hereditary risk pattern for review. A clinician can ask about it directly. Which relatives share a finding? And get an answer grounded strictly in that family's documented relationships. It never diagnoses. It never estimates a risk percentage. It surfaces the pattern and lets a clinician decide what it means. Underneath all four agents sits CockroachDB, the distributed, cloud-native system of record holding every thread, every approval, every immutable audit event, and every vector embedding that powers patient-scoped semantic search, built to keep running as this scales across a real hospital system. Amazon Bedrock runs Claude for clinical extraction and evidence-matching reasoning, Titan text embeddings for semantic search, and Amazon S3 for secure document storage. CareThread doesn't diagnose, and it doesn't act on its own. 4 agents, 1 shared memory, and a human who always has the final word. So a dropped follow-up never gets the last word instead.